Hello friends, today we'll discuss the role of what is HIPEC, that is Hyperthermic Intraperitoneal Chemotherapy. And in which kind of cancers do we use them? HIPEC is a relatively newer technology which involves giving chemotherapy inside the abdomen. Now in gastrointestinal cancers, we use HIPEC in a condition called Pseudomyxoma, where you have got blobs of mucin all over the abdomen. It is used in certain appendicular tumors arising from the appendix, which also presents in the form of blobs of mucin. And there are certain rare tumors called mesotheliomas. These are tumors that involve the inner lining of the abdominal cavity, which is called the peritoneal. And whenever this peritoneum is affected by this disease, by cancer, some of these patients will have a benefit of surgery plus HIPEC. Now the important caveat in HIPEC is that we should have a complete cytoreduction, meaning that all tumor has to come out surgically. There's no point in giving chemotherapy inside the abdomen if the disease can't come out completely. These surgeries involve a lot of extensive resections. Sometimes we take out a part of the colon, sometimes the whole colon, sometimes a part of the stomach, the spleen, the entire peritoneum. And after this, the patient receives chemotherapy inside the abdomen by a special machine with a little higher temperature. This ensures that once the tumor has come out, the microscopic cancer cells that are there within the lining of the abdomen are taken care of by the HIPEC. Now, HIPEC is a treatment modality that should be used very judiciously. It is not for all cancers. There are very select cancers where there is a clear advantage, and these are the cancers where it should be used. There are certain cancers where it doesn't have an advantage, and there we should be very judicious and we should not be using it without proper evidence, because HIPEC itself can have certain side effects. Complication rates are higher, leakage rates are higher from joints, bleeding can be a problem. Patients usually take much longer to recover after a HIPEC as compared to without. So I think it's very important to carefully and judiciously select which patient is appropriate for this treatment, and in those patients it really works very well. It works wonders, and it is a treatment that has excellent outcomes if the selection is done properly. Thank you.